everyone. It's another day on the Fifth Estate live on Akweya TV, your number one broadcast channel that brings you stories and history, art, and culture, analyzing how it affects our development as individuals and as a society. Before we go into the details of today's show, I want to tell you people something legit, proper gossip. So, for some of us, when they get side chicks, so story wey break out for social media be say one woman find out say her husband get side chick and him don dey chat with the babe, even tell the babe say him go divorce him wife because she don dey vex am. The woman come screenshot all their WhatsApp chats. She come wait until her husband birthday. She come do the man birthday cake, come plaster the chats on top the birthday cake. Instead to tell her husband happy birthday, na the chat wey you get with side chick na im come dey on top the cake. So for our men dem wey dey there, if na you, wetin you go do? Some persons don dey give you bad eye like this now because e no make sense to them na, but truly if na you, wetin you go do? If na you dey that kind situation, if na you be guest for that kind birthday, wetin you go do? Tell me wetin you think for the comment section. Meanwhile, like I said, it's the Fifth Estate live, and on today's show we will be discussing the input of our pharmacists, yes, the Pharmaceutical Society of Nigeria. In case you don't know, it's World Pharmacist Day. Yes, it's World Pharmacist Day, and the theme for this year is Pharmacists Meeting Global Health Need. And I have two very wonderful pharmacists with me in the studio. I have Dr. Sunday Olatunde. He's a clinical pharmacist. Yeah, you can remember him from last week's shows. Then I also have pharmacist Olufemi Daramola. Pharmacist Olufemi Daramola is the chairman, Education and Resource Committee of the Pharmaceutical Society of Nigeria, FCT chapters. And on today's show, we'll be discussing series of issues as relates to public health and medicine. Don't forget to like and share this video, and also join the conversation in the comment section. So, to the conversation, I would like you to individually tell me what meeting global health need means to you as a person and as a professional. Now, I need you to think about it as a common man, as a layman, and then as a pharmacist. So I'll start with Dr. Sunday.
Oh, thank you very much for having me on the program one more time this week.
You're welcome.
Thank you again for the question. What it means to meet global health need. From my perspective as an individual, separating myself again now from the pharmacy profession, I will expect that a profession that is meeting the health need is helping to relieve the burden of disease by either prevention or by prompt treatment, and by improving the quality of life of citizens globally, locally, and in the community where you live. I think that's what I think meeting the global health need will imply to me as a person. Okay. As to pharmacy profession, it may be a bit bigger than that, because in this case, we're talking of a profession that has the responsibility to actually meet these needs, apart from, let me say, in a teamwork with other healthcare professionals. And that, if you narrow it down to what will now be what a pharmacist should do or should be doing to meet global or to meeting global health needs, you'll be talking of pharmacy, because when you talk of pharmacy, you'll be talking of medication, medicines, and drugs, regardless the meanings you want to attribute to all these words. But you'll be talking of medication. In what way pharmacists globally meeting the global health need through their role as a member of the healthcare team, starting from a discovery of medicines, starting from making availability, accessibility, and affordability of medicine possible to the public, and also continue to engage in the public in advocacy in order to ensure prevention of diseases and generally broadening the knowledge of the citizenry or the entire globe of what diseases are, what medications are, and what they are to be doing as an individual in order to prevent disease condition and to live healthy life and to have a fantastic quality of life. Thank you.
So, pharmacist Olufemi.
Well, thank you, and I quite appreciate the opportunity that I'm here today. I would like to also appreciate the listeners that are listening at this moment. In terms of a profession meeting the global health needs, and what comes to, as an individual, what comes to my mind is universal health coverage, which is one of the Millennium Development Goals. As health is essential, it's pivotal, it's a necessity for every human being on earth. What am I trying to say? Every responsible government all over the world, they have that responsibility to ensure equal access to health, irrespective of who you are in the society, whether you are poor, whether you are rich. You know, health is essential. In many developed world, is at top of their program or their budget, of their expenditure. A lot of priority is given to health. And so it's a global stand that health should be accessible to every person, irrespective of where you live, whether you live in a village, you live in the city, you're a rich man, you're a poor man, you should have access to basic health care. And as a pharmacist, you know, so many things we are doing to ensure accessibility to health. When we talk about access, universal health coverage, or making health available to everyone, we talk about accessibility, and so many things come into play when we talk about accessibilities in terms of availability of healthcare facilities, availabilities of healthcare professionals, availability of medicines in the hospitals, availability of essential medicines, so to say, medical equipment, diagnostic equipment. All these things are basic and are fundamental. And as an expert, not only in just the use of medicine, because pharmacists are well trained in research and development of medicines, in manufacturing of these medicines, in regulation, in control of medicines, in distribution, in warehousing, and ultimately, and even the use of medicines itself. So a pharmacy has a lot of roles to play in ensuring a healthy society. Take, for example, I'm of the opinion that many people do not still know what they can derive from, working with their pharmacist. Healthcare now is a teamwork. Even patient is very, very important. Physician, like my colleague said, healthcare team, working together. But I'm driving down to a particular point. Drug selection is very important.
Yeah, so I would have to stop you on that drug selection.
Okay, thank you.
That's because we will be addressing that.
Oh, great.
So let's give our audience a little bit of suspense.
That's good, thank you.
Let's address the issue on assessing essential medicine. So while you were talking, you said something on the pharmacist ensures the manufacturing, the research and development of medicine, the distribution, warehousing, and all of that. So let's talk about the challenges now in Nigeria. What do you think are the challenges in ensuring that Nigeria is facing in ensuring the access to these essential medications by I don't want to say people of the lower class, by certain individuals? So what are the challenges that Nigeria is facing in that aspect, and how is the Pharmaceutical Society of Nigeria and pharmacists in general working towards, overcoming this challenge?
Thank you so much. I think that question is quite critical at this juncture in our country. We empathize with Nigerians in general in view of the recent, will I say, changes in our society, the high inflationary rate, the high exchange rate, fuel challenge. So many things are happening at the same time. And all these things are reducing the purchasing power of Nigerians. And I believe that we just need to hold on. With time, I believe we will overcome it. Now, the critical challenges we are having as a country are we divided into two. Maybe the pharmaceutical sector, the pharmaceutical industry per se, then patients, that is Nigerian populace. Now, in terms of pharmaceutical industry, like I just mentioned, the high exchange rates has driven up the cost of medicines. Now, I want to say that over 70% of medicines that are being used in Nigeria are imported, according to data released by National Health Institutes. Even from our West Africa a website also came out with that publication. That means we rely majorly on imported medicines to survive as a country, which is not the best. So, of course, when you look at the high exchange rate, naturally, you expect the cost of medicines to go up. That is one. Then two, the condition here in the country, the local capacity for drug production is also limited because of the government policies, hostile economic environment, high cost of production. Of course, you know what electricity tariff is now. We are grappling with that. So that and a lot of issues are driving up cost of production. Also, even for those companies producing in Nigeria, active pharmaceutical materials principles are being imported into the country because they are not still produced. So one way or the other, local production of medicine depends on importation of raw materials for final production of medicine. So cost of production is very high. The government policy is another thing. The exchange rate is another thing. So in terms of, there are of course the combat with fake and adulterated products is another thing. Parallel importation and also many unwholesome practices in the country. So these are some of the challenges that pharmaceutical sector per se are grappling with. And these are some of the driving factor, the cost driver for high cost of medicines of recent. Now, as Nigerians, what are we doing first as a profession to see how we can bring down the cost of production? We are doing all what we can to ensure that local capacity is there. NAFDAC is doing a lot. Of course, there was a year that they had to set a target by so year, the local capacity in drug production will have, So a lot of activities are going on in that place to make the environment more friendlier to local manufacturers of medicines. That is one. Then, of course, we want to appreciate the federal government for removing importation tariff on medicines of recent, and we hope that in some months' time, this will surely drive down the cost of medicines. But because the exchange rate is still there, it's still a factor. But of course, we engage in wholesome practices. This profession is highly regulated, ensuring that wholesome products are not finding their ways into the market. The Pharmacists Council is doing a lot of work. NAFDAC is doing a lot of work. The Pharmaceutical Society of Nigeria is doing a lot of work in sensitizing and working with professionals, the pharmacists, to ensure that things are done the right way, promoting ethics and values in the system. And let me pause now so that
let me quickly add
Dr. Sunday.
Yes.
So I want to ask you, pharmacist Olufemi has stated some of the challenges that pharmacists and Nigerians face with respect to access to essential medicine. But now we want to look at access in resource-constrained areas. We want to look at how pharmacists can contribute to the improvement of medicine supplies to all those rural communities that are almost out of the satellite towns. So how do you think that pharmacists are contributing or are expected to contribute to improve their access to medications?
Okay, thank you. Even before I go into that question, I would still like to add a little thing to what Pharmacist Daramola has just highlighted.
Okay.
You see, when you exist in a certain society, you are largely impacted with whatever happens to the economy of that society. And exactly that's what is happening with medications and pharmacy profession as we speak. There are three things that are actually impacted on the cost of medicine. That's when we say cost, we're talking of availability, accessibility, and affordability of medicines. One is the high tariff and VAT along the point or at the point of entry. You mentioned importation. Our import level, that when we talk of medicine security in Nigeria, is up to 70%, meaning that we are not so secure.
Yeah.
That's number one, about tariff. Number two is about exchange rate, as you mentioned. Number three is cost of energy. You see, the cost of energy, as we just talk about it, some people will feel it's just about economy. Well, economy of a nation is all encompassing.
Yeah.
True.
The health care of the people impacts on the economy. So when you talk of how does energy security affect cost of medicine, first and foremost, you know that you use energy to produce at the industry level. Two, you need energy to move the medicines around. You also need energy to store the medicine in the right condition. If you take a look at what energy will impact, you will know that energy is also one of the germane reasons that has impacted the cost of medicine. And when the cost is now a kind of a ballooning, skyrocketing, definitely you have taken accessibility and availability out of the reach of a common man. And the same thing will impact what you just told me now, the question you just put across, that the people at the hinterlands, how can pharmacists make or help to make medicines available to them? If I get the questions right.
Yes.
Okay. Whatever happens in the country will impact everybody, wherever you may have been living. But what can pharmacists do? I want to believe, number one, pharmacists should be ready to leave their comfort zone. I'm a pharmacist myself, but I know that in terms of distribution of pharmacists in the nation, if you go to the hinterlands, you hardly can see pharmacists practicing in those areas. And we know that primary health care should be the one that will be in those hinterlands and should be in the control of local government. Here we are, the local governments are almost non-functional, except through the recent executive the judgment that was
that
gave local government autonomy, financial autonomy. Okay, where there was no such kind of autonomy, that means that primary health care at the local government level may not function. If they don't function, where would the medication come from? So pharmacists, I know a lot of our pressure group have been working with different subnational government, the state government and the local government, with the hope that the present judgment is going to impact their financial autonomy very well. When that happens, we'll be able to have a functional, primary health care, and medications will be made available. So policy making is one way that pharmacists have been working to make sure that the people in the hinterland are not, deprived of the basic healthcare services and facility. But apart from that, is that availability of the professional is also very important. The federal government will have a role, state government will have a role where they have education, like universities where you produce pharmacy. We need more pharmacists in Nigeria. Yes, we are advocating using the avenue of this particular, celebration of our week to tell the government that we need more pharmacists in the country so that other people can go to the hinterland, because many pharmacists are in the city centers. There must be incentive. There was a time I was trying to register with some other countries in Africa. That's to secure their license. And I got to know that in that country, one of the countries in Southern African, region of this continent, is that when you want to go to the rural area, there's incentive for it. You are paid higher than those who are in the city. That's a kind of policy twist that can help mobilize healthcare professionals to the underserved areas so that you can have such hands. So I would like to yield the floor to Pharmacist Daramola to make a contribution to that.
Thank you, Dr. Sunday, for that brilliant contribution. Yeah, so many things that pharmacists can do to ensure equal access to medicines, particularly in the rural communities. I know we have a lot of outreaches, PSN, that is Pharmaceutical Society of Nigeria, at times occasionally, from time to time, identify some rural communities that where we go offer free medical services, prevention services. We even, in collaboration with other healthcare teams, treat people free of charge. And we know that there is high out-of-pocket expenditure in Nigeria.
Yes.
And it's very, very, very pathetic. So
Burdensome.
now, one of the key areas we can do is to ensure that unwholesome medicines are not there in the market. Illiterates are there. We just make it so simple. So we tell them the basic things they need to know in identify correct and genuine medicines. We have branded drugs, we have generic drugs. Why they might not be able to access those expensive medicines, they're equally affordable medicines that are of the same
so effective
pharmaceutical equivalent, you know, to the branded drugs. So by using those medicines, they will still get better. You know, you just provide that basic health information to people. Because of time, let me just.
Thank you very much. So, Dr. Sunday said something on needing more pharmacists, and you said something on literacy, educating the patients. So we're going on a short break, and when we come back, we'll address these two issues. Dear viewers, don't forget to like and share this video, and also join the conversation by leaving us a comment in the comment section. Stay tuned, we'll be right back.
In a world filled with impactful stories and transformative experiences, the essence of change is vital. That's where we come in. With over 16 years of experience shooting documentaries, we specialize in productions for local and international non-governmental organizations. Our focus is on showcasing the results and impacts of non-profit intervention on individuals, institutions, and society. We capture the success stories that emerge from these interventions, allowing project management experts to focus on designing projects with the greatest value to the beneficiaries. Our skilled team of filmmakers, storytellers, and technicians serve as a powerful tool, raising awareness, fostering empathy, and mobilizing support for the cause that truly matters. If you are a non-governmental organization looking to amplify.
Thank you so much for staying tuned. If you're just joining, it's the Fifth Estate Live on Akweya TV, and I've been in the studio with Dr. Sunday Olatunde and pharmacist Olufemi Daramola, and we've been discussing the Pharmacists Day. Yes, World Pharmacists Day. We're talking about the impacts of pharmacists in our society. So, as stated earlier, Dr. Sunday mentioned something on needing more pharmacists, and you said something on literacy. So let's talk about the literacy, right? How far has pharmacists in Nigeria engaged the public to promote healthcare literacy, address public health concerns on disease outbreak, communicable and non-communicable diseases, and adherence to treatments? Because I, for one, I remember growing up, I have this very bad habit. If I'm sick and I go to the hospital and take, for instance, they give me two, I like to call them card, these 2 sachets of amoxicillin.
Yes, amoxicillin.
And then I take the first one and I feel okay. I will dump the second one. I will dump the second one because I don't see what I'm doing with 2 when I'm feeling okay. That was until sometime 3 years ago. A nurse sat me down and said, the person will give you this medicine. It gets sense. So this is your actual dose. Why don't you just take it? It doesn't matter if you feel better or not, but that is the complete dose. Take it. So how far is the literacy level, the health promotion going in these areas to ensure that patients know that they have to adhere to treatment, to ensure that the public, especially those in the rural areas, those who do not have an idea, or even those in the city centers that also do not know the difference between communicable and non-communicable disease? Because in our Nigeria now, almost everything is communicable. So how far is the pharmacist going to address this issue? I'll start with Chairman.
Yes.
Yeah, thank you so much. It's a concern to every one of us, particularly in Nigeria, where health-seeking behavior is very bad. In the developed country, people go for routine medical checkup from time to time, and they're able to identify early if something is wrong with their system. Here, until some people are about to drop dead, that is where they remember that they need to go to
Guilty as charged.
So we really need to improve a lot of things, and that is where the pharmacist comes in.
Yeah.
Particularly when it comes to medication. So we call something pharmaceutical care, medication management. It's a professional core responsibility of a pharmacist, whereby a pharmacist enlist, how do I put it now? A pharmacist engage, develop a therapeutic relationship with patient so that they work together to achieve optimal treatment outcome. So basically, a pharmacist is very critical in health information, in providing the required information the client's patients needs to know concerning the medication they are taking. If you assess medication in America on maybe ordinary paracetamol, you'll be surprised the kind of leaflet you'll be handed over, to provide adequate information on that medicines. I think pharmacists by and large have been doing very well in dispensing appropriate medicines, in providing adequate information regarding dosing, frequency of use, and all sorts of things, particularly how to prevent adverse drug reaction, medication errors, what we call something drug-drug interaction. I want to tell you, a lot of people are struggling today in their health because of maybe misuse of medicines. And some of these things can be eliminated when they engage the services of a professional pharmacist. Engaging a professional pharmacist may just be the game changer in that lingering health crisis. So pharmacists are doing a lot, and a lot of pharmacists are involved in public health in intervention programs, maybe HIV/AIDS, malaria control, tuberculosis control. Personally, I've worked for many years in HIV/AIDS controls where adherence to medication is very key. For antiretroviral drugs now, if you miss 1 or 2 days, it's a serious problem. Yes. So we have a lot of messaging, leaflets, adherence support programs to aid people. Even we have some of those messages in local languages, in Hausas, in Yorubas, in local languages, to ensure that people at the grassroots, are carried along, engaging the community leaders and gatekeepers to ensure that people are well educated. Thank you.
With respect to that. So, Dr. Sunday, still on the issue of public health education, right? Now, let's give an instance. We had Ebola as at 2014, 2015. Then we had COVID-19. These two incidents, these two outbreaks really changed the trajectory of so many individuals. For instance, I was in UNN at the time. I was writing for UTME when somebody woke me up and said, they say, "Make you bath with salt water. If you bath with salt water, you go catch Ebola." Right? And so many persons were bathing with salt water. They were drinking salt and water solution because somebody somewhere has said, if you do this, you will not contact Ebola. During the COVID-19 also, we saw people saying, oh, if you take lime orange, if you take vitamin C and all of that. So is it that the Pharmaceutical Society of Nigeria or even pharmacists themselves are not aggressive in giving out the messages, or they are not prompt to respond in times of disease outbreak? Because I feel like when we have disease outbreak, education and information should go side by side.
That's true.
So is it that they are not prompt, or they are not just aggressive enough with respect to giving that information?
Yeah, thank you very much. To actually go straight to give you answers to this question. You see, we interestingly find ourselves in a very interesting time. Unlike the traditional media, that you are a member of such kind of media, you see that passing information these days has been challenging. The right information, if it's not massively targeted, the wrong information that is massively targeted will overwhelm the other source. Were the sources of this information then? They were social media information. The veracity of every information will be determined by who is saying it. Who exactly said that? But because it was massively disseminated, it overwhelmed the real information. And I think that's the challenge, not because we're not pushing enough. I could remember I was on several radio stations and TV stations during that time to give the right information. Many people were sending us different messages, whether what they had was correct or not, and we're responding. But because, you see, social media has been a challenging source of disseminating information, where there's no control, and what gets to the public is not in control of anybody. So I want to believe that we need to do more in terms of having in mind that social media, if care is not taken, can overwhelm whatever we want to say. And we have to go as aggressive as they always go to, so that we can counter with truth every information that is not true. That I feel we should do better. But that does not mean that we are doing so much. Pharmacists, I want to tell you, before Pharmacist Daramola took over, I think it was Dr. Danraka that was in charge. There were times that the Pharmaceutical Society of Nigeria paid some stations, TV stations, radio stations, that members of Pharmaceutical Society of Nigeria will go there every week to educate the public on different areas of medical. I've been on several stations to discuss drug interactions. I've been there to discuss clinical trials. I've been there to discuss, what's it called? There are so many. In fact, during the time of outbreak of cholera, I was one of the invited guests, sponsored by Pharmaceutical Society of Nigeria. Therefore, it means that the body is trying to push information across to the society. But our information is not limited to what we do on the media, whether print or electronic media. Let's take a look at the roles of pharmacists and how we educate them. You know, we are the source of education to all healthcare providers as far as medications are concerned. Okay. When a pharmacist finishes producing a medicine, he is the one who knows that medicine in total, from the beginning of its discovery to taking it to manufacturing outlets and bringing it out as a medication. It now goes from that level to go to hospitals or where you have medical practitioners to educate them on how to use that medicine. Are you getting it? So the first role is to educate the healthcare providers who make services related to medication use available. So whatever they tell the public is what the pharmacist has indirectly told them before they start using the same this thing. So pharmacists have been doing a lot from that, and that's why you see an Alfred leaflet you see with a medicine is written by the pharmacist who produced the medicine. That is to make information available to other healthcare providers and to make it available to the public. So we do all of this, and at our various facilities where we work, we engage patients one-on-one to tell them what they need to know about their medicine. On some of the government radio stations, some of us have represented the body of the Pharmaceutical Society of Nigeria to speak concerning some certain issues. So there are a lot we have been doing, and I want to believe that we will continue to do and to put our best across.
I hope so too. Yeah. So Dr. Sunday mentioned something about the comparison between the right information and the wrong information. Yes. So he said the social media is a place where a lot happens, right? Now, let's look at having foot soldiers. Because I want to believe that it's because they are foot soldiers for the wrong information. That is why it is subduing the right information. And earlier on, he had mentioned that we need more pharmacists as for students, which can actually be our foot soldiers. But then, some youngsters do not even want to study pharmacy in school because they feel like, if I go study pharmacy now, I won't work when I graduate. So let's look at it from that angle. Do we have the facility? Do we have the environment to welcome these young foot soldiers? So I'm looking to
Pharmacist Daramola. Thank you so much for that question. But before that, I just want to add up one or two things to what is mentioned. I want to say that our emergency preparedness as a country is something that we need to look at. How to respond to epidemics, outbreaks of diseases is very, very important. But at the same time, I must commend the government for early containment of Ebola. Nigeria as a country was commended globally for the way we were able to contain that. Even though a lot of misinformation went
viral at the time.
We were able to get over. I worked directly on COVID response team for the country, so and I knew a lot of efforts that, went that line. And pharmacists play active role across the spectrum of public health diseases in Nigeria, particularly in supply chain management, in provision of critical health needs, in warehouse and distribution of some of these products, and passing appropriate information along the line. And so let me just stop that and respond to this. Yeah, we indeed need more pharmacists in the country. If you look at number of clients and the population to number of pharmacists, as at the time I left school, which was over 20 years ago,
Yes.
there were about 9,000, if up to, pharmacists, for the whole country.
Yeah.
And now that Nigeria population is about 20,
Wow.
just imagine the number of pharmacists that we need. A country, America, that with about 300 something population, million in population, they have about 4 something million pharmacists.
Can you imagine?
And they still need more because they still have critical gap. That shows clearly that pharmacists are carrying out essential, duties in that country.
That's true.
Then in this country, I don't know whether you have.
As at the time I was leaving, it was about 21,000 pharmacists to 220 million people, and that's about 1/3 of that has traveled out.
Yes.
And more is still traveling.
So Japa syndrome is affecting the pharmacists as a profession. So, and we need to provide that conducive environment, that platform for the young ones to leverage on. So there are many platforms available, open to young pharmacists, for their career development. We have hospital practice, which is their community practice, regulation control, in terms of NAFDAC, importation, licensing, and so many other things, even narcotic drugs control. Then, of course, in public care programs, of course, supply chain management, pharmaceutical care. There are so many opportunities that are out there for every promising young pharmacist. The sky, I will not say is the limit. It's just about you and what you do with the opportunities you have before you. So knowledge is very key. Information is very key. Let them get information, let them get knowledge from the right source, and they go up from there. Thank you.
Okay, so far we've been talking about all the challenges and what the Pharmaceutical Society and pharmacists in general are doing to handle these challenges. So let's look at meeting global health need. Meeting global health need is a sustainable development goal. So what are pharmacists in Nigeria doing? Like, is there some sort of collaboration with other agencies with respect to achieving these sustainable development goals? Are we collaborating with the local government? Are we collaborating with the power sector? What are the collaborations on ground, even with the public health sector, to ensure that this sustainable goal is achieved? So who goes first? Anybody can answer me, actually. It's an open question.
Okay. A lot of programs are being carried out and some in the pipeline to see how pharmacists can contribute to this universal health coverage for all. And of course, when we talk about pharmacists, what comes to people's mind quickly is medicine, medication. Yes. And we spend a lot of time talking about some of the challenges, assessing medicines in Nigeria. So there are many things that we are doing currently. We have a PSM foundation.
Yes.
That is more like a foundation and an NGO, and they are collaborating with funders, donors, to see how they can promote health, particularly in hinterlands, in rural communities, hard to reach terrain. And that is one area that we need to look at, and we invite more donor organizations, more funders to consider working directly with pharmacists. When we were talking, you mentioned adherence, which is very key. Adherence is very key, and that needs a lot of support, a lot of resources to be able to drive down the messages, as we have been talking about. That is key. Then, of course, pharmacists are playing clinical roles, as I mentioned before, in various public health programs, tuberculosis control program, the tuberculosis medicines, HIV medicine, antiretrovirus, immunizations, a lot of things have been done in terms of warehousing of these commodities, in terms of distribution of these commodities, in terms of ensuring quality of this commodity, efficacy of these commodities. Because one thing is for you to use medicine, and that is for you to get results for the medicines you are using. These are things that pharmacists are doing that the public may not know, because medicine is very essential. Pharmacists are not only trained just on medication. There are a lot of prevention services that pharmacists are carrying out. We have community pharmacists in their various outlets that engaging. These people are directly in touch with the people in the community. That's the first point of call for anyone that is sick in the community. So they have access. A lot of pharmacists are doing very well, carrying out free medical screening, medical services, health information services at that community level, which I think is very, very important. No wonder in the US, I think the pharmacists were given that power to immunize people, to vaccinate people. So, and that is why we are looking at expanding roles for pharmacists in Nigeria. I mean, legally, so that, because they are in touch with people at the grassroots, they have that ability to reach out to people even more. And of course, they know the time of referral when they need to refer people to hospital as may be appropriate.
Okay.
Thank you. Let me quickly add to that. We have been involved in policy formulation, policy implementation, policy review, and in different, working together with different agencies of government. Of course, we know one of the problems of the society or the community we find ourselves is being able to pay out of pocket for healthcare services. So NHIS has come to remedy that if it is comprehensive. So we have been working with NHIS to influence policy in the areas that medications will be accessible and affordable to patients. When people don't have fear of paying out of pocket. Of course, sicknesses wouldn't write letter to anyone. They come. In fact, in some time or some cases, you are broke as at the time they come. But for you to be able to assess, you will need money in our situation, where which you don't need to get money carried along with you to go and access healthcare facility. Such kind of situation will promote accessibility of healthcare and affordability. So we've been working in terms of policy formulation. And there was a time you see, part of the development goal, roll back malaria kind of, policy and program. Community pharmacists were used to distribute products, were used to distribute insecticide-treated mosquito nets, and the rest of all of that. So we work at policy formulation level, policy implementation with different agencies of government. And that's, I think, we can continue doing that.
Yeah, in addition to that, even vaccination, COVID-19 vaccines, some community pharmacists were used as a vaccination outlet. And nationally, as Federal Ministry of Health, they have various organs of government that are really helping to manage supply chain of medicines in Nigeria. And pharmacists are playing critical role, like in that body, NPSCMP, for example, that control the warehousing, distribution, and control of the public health products, like the HIV/AIDS, tuberculosis, malaria, a host of them, and we are quite active in that space. Thank you.
Okay, it's been a wonderful time in the studio with pharmacist Olufemi Daramola, don't forget, and then Dr. Sunday Olatunde. Before we actually wrap up the show, I have one major question that's been bugging my mind, and I'm sure it's concerning to some people out there. That is, we see pharmacists coming, the Pharmaceutical Society of Nigeria shutting down pharmacies, quack pharmacists, but we don't see them arresting those people who sell drugs at the motor park, and those ones who sell drugs in the markets, those ones who carry drugs in their bag, them small baskets, and then they are selling a mixture of paracetamol and the rest of them. We don't see them picking up those guys, but mostly in our society we see them coming to shut down some pharmacies because they are quack. So is it that the Pharmaceutical Society of Nigeria do not have the legal framework to curtail those guys at the motor park, or something is happening that we need to know about?
Okay.
So that will be the last question for the show.
Thank you.
Okay, I believe you meant the Pharmaceutical Council of
Okay.
Nigeria.
Council.
Because
Okay.
Pharmaceutical Society of Nigeria is just a professional body.
Okay.
But we have a government organ that regulates the practice of the
Okay.
profession in Nigeria that is saddled with that responsibility, and that organ is Pharmacists Council of Nigeria. So they regulate the practice of this profession in this country.
Okay.
And they have that legal right, that oversight functions to ensure that pharmacists are working within the ethics, within the standard, the set out rules to ensure that we are able to keep the health of people. You know, we are able to sustain good health for people, that people are able to access good, uncompromised medicines. So yes, they go from time to time to register premises to ensure that pharmacists are working within the legal rules. We have problem in Nigeria. And pharmacy is more like becoming an open business. That those that have no business in selling of medicines are just
now
there.
opening pharmacies.
This is now beyond the pharmacists as a group. We have law enforcement agents. We have so many government organs. You know, it's a teamwork. It's a collaborative work. I mean, for us to be able to sanitize the chaotic drug distribution in Nigeria, it requires a deliberate government, effort and teamwork. So pharmacists wanted to do some of these things, but there are a lot of legal, requirements, a lot of injunctions preventing effective monitoring, tracking, and regulation of pharmaceutical products in Nigeria. But nonetheless, we are doing what we can within our ability.
Thank you. Dr. Sunday, do you want to contribute to that?
Yes, let me add a little thing. And thank you, sir, for Pharmacist Daramola for the clarification. Pharmaceutical Society of Nigeria is an association of pharmacists who are practicing in different areas. So we have even different pressure groups under that umbrella. However, we have Pharmacy Council of Nigeria, which is a regulatory body that regulates the practice of pharmacy in Nigeria. It's a government-owned agency. And in their operation, they register all pharmaceutical outlets nationally, whether you talk of industry where drugs are manufactured, or you talk of dispensing facilities in the one you call the community pharmacy and all that. So they work to the best of their ability. But I don't think the ability is enough for the enormity of regulatory work that is required in Nigeria. Your observations were quite correct, that you see people selling a lot of things, medication, non-medication, concoction here and there in different nook and cranny of the country. You can only charge Pharmacy Council of Nigeria to do better and to beam their searchlight into those areas. But sometimes when people are overwhelmed with work, they prioritize what is most dangerous and leave what is not as dangerous. You have somebody that has outlets who is not supposed to have that outlet. He has taken some illegal route to have that outlet, or that outlet is no longer even registered in the radar of monitoring. Of course, you know that if you want to give out medicine, your outlet has to be registered and should be monitored. But when you are not in the radar, where that's the line where they can build searchlight on you, then you become an illegal entity there. So they will first look at those ones, try to descend on those ones. While you now talk of somebody that carry 2 or 3 sachets of paracetamol, that one is a kind of lower, harm. So they try to prioritize like that. But we want to tell government and tell Pharmacy Council of Nigeria, if it's to recruit, they should recruit more. But I must tell you, Nigeria has not been recruiting for the past. What they do now is a replacement. I mean, for some time now, since President Buhari came to power, they put a kind of embargo on federal employment. So you see that many of those agencies have been using the same set of staff, the capacity of staff, to maintain and to do their work. So when it's not enough, they try to find a way of concentrating on most dangerous things. And that's why things have not been worse than this. So I want to believe that with this charge, they should also sit up and do better.
Yeah. Just to add to that, Nigeria is about the only country in the world that you have a non-professional handling medicine.
So
So I think that is an
It's
area
important.
that we need to look at. We
Right.
just need to
It's
get
an
it
area
right.
of concern.
Yeah.
Just need to get it right.
So it's been a wonderful time on the Fifth Estate Live show with Dr. Sunday Olatunde and pharmacist Olufemi Daramola, and we've been assessing, analyzing the role of pharmacists when it comes to public health and distribution of medicines in the country. So I hope you enjoyed today's show. Do also like and share this video. Also subscribe to our channel and click on the notification bell so you're notified whenever we make a post. And don't forget to follow us on all our social media platforms. Until we come your way again next time. I beg. When I don't hear am, no go just buy medicine carelessly. Oh. No go buy medicine carelessly. Oh. Una don hear am. Oh. No go buy medicine carelessly. Oh. Hey. Before you go send a headache worry you, we go come dey treat the one with big pass headache. And I really hope that the government will look into people selling drugs in motor parks and markets and all those irregular areas, because what we think is not an issue now can become an issue tomorrow. But till we come your way again next time, enjoy the rest of your day and the rest of your week. Bye bye.